And thanks very much for joining me. My name's Nicole Hamilton. I'm a physiotherapist with Synergy Physio on the Sunshine Coast of Queensland, Australia. What I'd like to do today is share some tips and advice on how to minimise your back pain and how to adjust your yoga practice to manage this. So in this clip what we'll be looking at is back pain that occurs in back bends. So back bends can include on your stomach, such as Sphinx or Cobra or Up Dog, or on your back, such as bridge pose or full wheel pose. Now, there can be many reasons for back pain with back bends, which is why it's always best to get individual assessment and advice from a health professional. But the most common reason that I see is excessive compression or squash through the lower lumbar vertebra. So let's start by having a look at our anatomy. So we can see here from the model that the lower lumbar spine stacks up like a building block on top of the pelvis, which works like the foundation of the building. Between each of your vertebrae you've got a disc, and you've also got small joints at the back of your vertebra called your facet joints. Your facet joints tend to slide open when you bend forward a little, and they also slide back and compress together when you lean backwards. So what should happen in the lower back when we go into a back bend? Really, essentially what should happen is that all of the vertebrae should contribute to the movement just a little bit, like links in a chain. So we should extend a little bit through the upper torso. Our hips and groin should also open and extend, which will minimise the compression in the lower lumbar segments. One of the most common reasons I see for pain in the low back during back bends is excessive compression in the lower lumbar vertebra, and this usually happens because there's not enough stretch or mobility happening from the hip or the upper torso in back bends. So in the end you end up back bending like a hinge on the lower lumbar vertebra, and that excessive hinge-like motion can make the facet joints complain. The other reason for pain in back bends that can occur in some people is a spondylolisthesis, which is essentially where one of the lumbar vertebrae have slid forward just a little, which means that joint or that segment is a little bit vulnerable with back bending. So how can we minimise the squash in the lower back during our yoga practice? Well, the first thing is to make sure we have enough preparation postures. Preparation postures are designed to open up the front of the hips, so the hip flexors and the rectus femoris, and also open up the thoracic area, torso and shoulders. So there are many preparation postures that you can try for back bends in opening up the fronts of the hips, which includes the hip flexors and the rectus femoris. A couple that I like though are a kneeling thigh stretch, which is a great one for the rectus femoris. And to increase that stretch, you can actually try reaching the ankle with the opposite hand, which can just increase the stretch. If your knee is a little bit grumpy and you don't like kneeling on your knee with that stretch, you can try this stretch with a chair. So again, that'll open up the rectus femoris and part of the hip flexors, and if you squat into the stretch, it'll just increase that opening stretch on those muscles. So another more passive way of opening up the hip flexors is to lie on your back, and you can grab your opposite ankle with your hand and then hug that knee towards your chest, allowing your knee to soften and relax down toward the floor. That's another great hip flexor and rectus femoris stretch. So if we look now at a few preparation postures to open up the torso, and this is especially important for supine back bends such as full wheel pose. If you can find a wall and come into a modified dog pose, it's a nice way of opening up the lats and also the thoracic area. You can increase the stretch by adding a little twist by dropping one hand, which will help open up one side of the torso. Another way to increase this stretch would be to bend the elbows, which will increase the stretch through the lats, which is a great preparation posture for back bends. A final way of stretching the upper torso is a nice passive way that I like, lying supine over a foam roller or a bolster, opening the arms out and just having a few breaths in this position. So now that you've done some preparation postures for back bends, the next thing is to know what to do during back bends to protect your lower back from hinging. The first thing is to create a little bit of posterior pelvic tilt. So if you can imagine your pelvis a bit like a bucket of water, if you tip a little bit of water out the back of that bucket, that's called posterior pelvic tilt. If you tip a little bit of water out the front of that bucket, that's called anterior pelvic tilt. And if you've got too much water going out the front of the bucket and you lean back, it creates a big hinge onto that lower lumbar segment. So during all back bends, if you can maintain just a very small pelvic tilt posteriorly, that would be great. The way to create that is to imagine a connection between your pubic bone and navel. This is better than clenching your bottom and tucking your tailbone under, but a small wire or connection from your pubic bone to your navel is a nice way of creating that posterior pelvic tilt. Another way of protecting your low back during back bends is to learn to engage your core. Your core muscles consist of your lower abdominals, called your transversus abdominis, and your pelvic floor. A few ways that you can learn to contract this would be if you can imagine your two front hip bones drawing together very slightly, that can help activate the transversus. Or if you lift your bladder muscles or activate your pelvic floor, that's another way that can help activate these muscles that protect the lumbar spine. If you're having difficulty figuring out how to contract those muscles, it's best to seek the advice from a physiotherapist who might be able to teach you individually. So if we think about all of those cues when we're going into a back bend, so firstly, connect the pubic bone to the navel, which creates a little bit of posterior pelvic tilt. Then, Kat, can you gently activate your core muscle by lifting the bladder muscle very gently? And then if you can, lift up into your back bend, cobra or sphinx. But can you think of opening the heart and opening the collarbones so you create some extension through the torso and less likely to pinch and compress through the lower lumbar vertebra? And if we look at some supine back bends, just such as a simple bridge, which is an easier version of full wheel, the same preparation can be applied. So Kat, if you can gently imagine a wire connecting your pubic bone to your navel, so go into a little bit of posterior pelvic tilt, activate your core very gently, and then lift the hips up off the floor and imagine some length through your groin, lengthening through the front thigh. And then can you open up the heart and open up the collarbones to create some opening through the torso and the hips, thereby minimizing the squash through the lower lumbar vertebra. So to summarize ideas for pain with back bends, make sure you do enough preparation postures. These postures should include stretches to hip flexors, upper back and thoracic area, and the lats and shoulders. Make sure you have an understanding of how to accurately engage your core and use this idea prior to moving into a back bend. A small posterior pelvic tilt can also help. Throughout a back bend with your core on, if you can visualize opening the heart area, lengthening the hip and groin, it will encourage movement at these places and prevent a hinge-like movement at the lower lumbar vertebra. If you have ongoing pain, the best advice would be to avoid back bends and seek the advice from a health professional, as there may be other yoga poses you can do to address your individual problem. Thanks very much for joining me, and I hope the information that I've provided has helped you find ways of modifying your yoga practice to help you with your recovery.